Hello, I'm Dr. Lucas Mason, and today we're going to talk about something that concerns millions of people over 60. That stubborn belly fat that seems impossible to lose, no matter how much we diet or walk. But here's what most people don't know. After 60, your body doesn't respond to exercise the same way it did when you were younger. And that's not your fault. It's biology. The traditional exercises that worked in your 30s or 40s might actually be working against you now. Your metabolism has changed, your hormones have shifted, and your body needs a completely different approach. Today, I'm going to share with you 5 specific exercises that work with your body's current reality, not against it. These aren't punishing workouts. They're intelligent movements designed specifically for bodies over 60, and the science behind them might surprise you. Let me start with something that might shock you. Doing hundreds of sit-ups or crunches at your age can actually make belly fat harder to lose. Why? Because these exercises put enormous pressure on your spine. They can spike your cortisol levels, the stress hormone, and high cortisol tells your body to store fat right around your midsection. I learned this the hard way through my patients. Margaret came to see me 2 years ago. She was 63, frustrated and exhausted. She'd been doing sit-ups every morning for 8 months. Her back hurt, her neck was stiff, and her belly exactly the same size. When I explained what was happening inside her body, she looked at me and said, "So I've been fighting against myself this whole time?" And sadly, yes, she had been. But here's the good news. Once we changed her approach, once we started working with her body instead of against it, everything shifted. In 4 months, she lost 3 inches from her waist. Her back pain disappeared, and she had more energy than she'd had in years. So what changed? We stopped focusing on exhausting exercises and started activating the deep core muscles, the ones that actually control belly fat. Let me explain something crucial. There are 2 types of abdominal muscles. The ones you see in photos, the six-pack muscles, those are called the rectus abdominis. But underneath those, deep inside, there's a muscle called the transversus abdominis. Think of it like a natural corset that wraps around your entire midsection. After 60, most people have lost connection with this deep muscle. It's still there, but it's asleep. And when that muscle is inactive, your belly pushes forward, your posture suffers, and fat accumulates right where you don't want it. The exercises I'm about to show you wake up that muscle. They reignite the connection between your brain and your deep core. And when that happens, your body starts burning belly fat more efficiently. But before we get to the exercises, you need to understand one more thing: why belly fat behaves differently after 60. When you reach your 60s, several changes happen simultaneously. Your growth hormone levels drop significantly. This hormone helps build muscle and burn fat. With less of it, your body naturally stores more fat, especially around the middle. Your testosterone levels decrease. Even in women, you have testosterone too, and this affects muscle mass and fat distribution. And perhaps most importantly, your insulin sensitivity changes. Your cells don't respond to insulin the way they used to, which means more sugar gets converted into belly fat. Add to this the natural decline in muscle mass, what doctors call sarcopenia, and you have the perfect storm for stubborn belly fat. But here's what gives me hope, and what should give you hope too. Your body still responds to the right stimulus. It just needs a smarter approach. Now let's talk about the first exercise. Dead bug breathing. I know, strange name, but this exercise is extraordinarily powerful for people over 60. Here's why. It combines deep core activation with controlled breathing, and that combination tells your body to release fat-burning hormones while protecting your spine. Here's how you do it. Lie on your back on a comfortable mat. Bend your knees at 90 degrees, feet flat on the floor. Place your hands on your lower belly, just below your navel. Now, take a slow breath in through your nose. As you breathe out through your mouth, gently pull your belly button toward your spine. Not forcefully, gently. You should feel your lower back pressing into the floor. Hold that gentle contraction for 3 seconds. Then slowly lift one foot off the ground, just a few inches. Keep your knee bent, hold for 5 seconds, lower it, then lift the other foot. That's 1 repetition. Do 10 repetitions 3 times per week. What's happening inside your body during this exercise? You're activating your transversus abdominis without any spinal compression. You're teaching your nervous system to stabilize your core, and you're doing it in the safest possible position. Robert, one of my patients, told me this exercise changed his life. He's 68, had 2 back surgeries, and thought he'd never be able to strengthen his core again. After 6 weeks of dead bug breathing, his posture improved, his back pain reduced by 70%, and he lost 2 inches from his waist. The second exercise is called standing pelvic tilts, and this one addresses something most people over 60 struggle with: anterior pelvic tilt. Let me explain. As we age, especially if we sit a lot, our pelvis tilts forward. This makes our belly stick out, even if we don't have much fat. It also puts pressure on our lower back and makes it harder for our deep core muscles to activate. Standing pelvic tilts correct this. Here's how. Stand with your back against a wall, feet about 6 inches away from the wall. Your buttocks, shoulder blades, and head should touch the wall. Place one hand behind your lower back. You'll probably feel a space there. That's the forward tilt we're going to fix. Now, take a breath in. As you breathe out, gently tilt your pelvis backward, pressing your lower back toward the wall, closing that space. You should feel your lower abdominal muscles engage. Hold for 5 seconds, release. Repeat 15 times. Do this twice a day, morning and evening. It takes less than 2 minutes. What makes this exercise so effective? It retrains your posture. It activates your lower abs and your pelvic floor simultaneously, and it creates space in your hip flexors, which often become tight with age and contribute to belly protrusion. Linda, 61 years old, started doing this exercise while waiting for her morning coffee. Just that, 2 minutes a day. After 3 weeks, she noticed her pants fitting differently. After 2 months, she'd lost 1.5 inches from her waist, and her chronic lower back discomfort had vanished. The third exercise, modified side planks. Now I know what you're thinking. Planks sound hard, and you're right. Traditional planks can be too demanding for many people over 60, but this modification is different. It's accessible, safe, and incredibly effective. Here's why side planks matter. They target your obliques, the muscles on the sides of your waist. Strong obliques reduce waist circumference and improve balance, which becomes crucial as we age. Here's how to do the modified version. Lie on your side on a mat. Bend your knees at 90 degrees. Prop yourself up on your forearm, elbow directly under your shoulder. Now, simply lift your hips off the ground until your body forms a straight line from your knees to your shoulders. That's it. Start by holding for 10 seconds. Rest for 30 seconds. Repeat 3 times on each side. As you get stronger, and you will, increase the hold time by 5 seconds each week. What's happening? You're building lateral core strength without spinal compression. You're improving hip stability, and you're activating muscles that directly reduce waist measurement. Thomas, 65, told me he couldn't believe something that looked so simple could be so challenging and so effective. After 8 weeks, he'd built enough core strength to play with his grandchildren without back pain, and his waist had shrunk by 2 inches. The fourth exercise is perhaps the most important: diaphragmatic breathing with core engagement. This might not sound like an exercise at all, but listen carefully. How you breathe directly affects belly fat. Most people over 60 breathe shallowly, using only their chest. This type of breathing keeps your body in a mild state of stress, elevating cortisol, which, as I mentioned earlier, promotes belly fat storage. Deep diaphragmatic breathing does the opposite. It activates your parasympathetic nervous system, reduces cortisol, and creates the hormonal environment for fat burning. Here's how. Sit comfortably in a chair, feet flat on the floor. Place one hand on your chest, the other on your belly. Breathe in slowly through your nose for 4 counts. Your belly should expand, pushing your hand out. Your chest should barely move. Hold for 2 counts. Breathe out slowly through your mouth for 6 counts. As you exhale, gently engage your core, pulling your belly button toward your spine. Pause for 2 counts. That's 1 cycle. Do 10 cycles 3 times a day. This exercise does something remarkable. It combines stress reduction with core activation. It improves oxygen delivery to your tissues, enhancing metabolism. And it creates a mind-body connection that makes all other exercises more effective. Sarah, 62, had been dealing with anxiety and belly weight for years. Her doctor had told her it was all stress-related, but she didn't know what to do about it. When she started this breathing practice, everything changed. Her anxiety decreased, her sleep improved, and over 6 months, she lost 12 pounds, most of it from her midsection. The fifth and final exercise, seated knee raises with torso twist. This exercise is perfect because you can do it anywhere. Waiting for the doctor? Do it. Watching television? Do it. It requires no equipment, no floor work, and it targets multiple areas simultaneously. Here's how. Sit forward in a sturdy chair, away from the backrest. Sit tall, shoulders back. Place your hands lightly on the sides of the chair for support. Engage your core by gently pulling your belly button in. Now, slowly lift your right knee toward your chest while simultaneously rotating your torso slightly to the right. Lower with control. Repeat on the left side. Start with 10 repetitions on each side, twice a day. What makes this effective? You're combining core flexion with rotation, targeting both your rectus abdominis and your obliques. You're doing it from a seated position, which protects your back. And you're building functional strength that translates to everyday activities like getting in and out of cars or reaching for objects. Now, here's what you need to know about making these exercises work. Consistency matters more than intensity. Doing these exercises 3 times a week for 20 minutes is infinitely more effective than doing a punishing hour-long workout once a week and then being too sore to move for days. Proper breathing is not optional. Every single one of these exercises works better when you breathe correctly. Exhale during the effort. This naturally engages your deep core and protects your spine. Quality over quantity. 10 perfect repetitions are worth more than 50 sloppy ones. Focus on feeling the right muscles working. If you're not sure, Slow down and concentrate. And please, listen to your body. If something causes pain, not discomfort, but actual pain, stop, modify, ask for help. These exercises should feel challenging, but never painful. Let me tell you about William. He's 71. When he first came to see me, he was discouraged. He'd tried everything. Diet plans, walking programs, even some intense workout videos that left him injured. I sat down with him and explained everything I've shared with you today. We started slowly. Just the dead bug breathing and the diaphragmatic breathing for the first 2 weeks. Then we gradually added the others. 6 months later, William had lost 15 pounds. His waist had decreased by 4 inches. His blood pressure had improved. His doctor reduced his diabetes medication. But what mattered most to William? He could bend down to tie his shoes without getting winded. He could keep up with his grandchildren. He felt like himself again. And that's what this is really about. Yes, reducing belly fat matters for your health. Visceral fat, the fat around your organs, increases your risk for heart disease, diabetes, and other serious conditions. But beyond the numbers and the measurements, this is about reclaiming your quality of life. You deserve to feel strong. You deserve to move without pain. You deserve to look in the mirror and feel proud of your body and everything it's carried you through. These 5 exercises are tools, but they're not magic. You have to use them. You have to commit to 20 minutes 3 times a week. You have to be patient with yourself and trust the process. And remember, you're not trying to look like you did at 30. You're trying to be the healthiest, strongest version of your 60-year-old self. And that is something to be proud of. Start today. Start with 1 exercise. Tomorrow, add another. By next week, you can be doing all 5. And in 3 months, you'll be amazed at how different you feel. You're not alone in this journey. Millions of people over 60 are facing the same challenges, but you now have information that most of them don't have. You understand why your body has changed and what to do about it. Take that first step. Your future self will thank you. I'm Dr. Lucas Mason, and I believe in your ability to transform your health, one intentional movement at a time.